Digital healthcare could help deliver tailored advice to women experiencing pregnancy difficulties. Personalized coaching through a smartphone platform can help women improve their lifestyle behaviors in the period before and shortly after they become pregnant, a new study has shown. The biggest reduction in behaviors that pose risks to pregnancy were seen in overweight women. The findings, published in the journal Reproductive Biomedicine Online, show that digital healthcare could be a cost-effective way to deliver tailored advice to women who experience difficulties in pregnancy, which the NHS does not have the resources to provide. In this study, led by the University of Southampton, 262 women who were planning pregnancies and had either experienced difficulties in conceiving or recurrent miscarriages signed up to the online lifestyle coaching program Smarter Pregnancy. All participants completed questionnaires through the app at the beginning and at 6-week intervals over the 4-month trial. The questionnaires covered subjects such as their diet, folic acid intake, smoking and consumption of alcohol. Healthy habits of pregnancy. Latest science show maternal habits affect pregnancy success. Maternal and paternal inflammatory disease can affect pregnancy outcomes. New chip, mimicking bovine endometrium, could play key role in cattle's pregnancy success. After each questionnaire, half of the participants, the intervention group, were sent automated advice and recommendations through the coaching platform, based on their responses. The other half, the control group, were referred to standard guidance for periconceptional care on the NHS. Analysis of the responses to the questionnaires showed that the group receiving advice through the Smarter Pregnancy platform were more likely to make positive changes to their lifestyle over the course of the trial than participants in the control group. The most significant change was in the reduction in smoking and drinking alcohol for those with a body mass index above 25, overweight. The findings also showed that the odds of becoming pregnant after 24 weeks were increased for the participants using the app, although the study team note that more research would be needed to validate this connection, as this study was targeted on improving lifestyle choices rather than assessing pregnancy rates.